If you work in healthcare, if you're a medical student or a resident, or if you're a rheumatology patient, this video is for you. If you are ever seeing a patient who is on an IL-6 blocking biologic, so these are things like tocilizumab or Actemra, there's also a new version called Tyenne, or Kevzara, also known as sarilumab. It is important to note that no matter how sick these patients are, their CRP, so a marker of inflammation, is likely always going to be normal, even if they are sick. And this is because our body actually needs IL-6 in order to produce a CRP. So these patients will always have a normal CRP, even if they, for example, have a really bad infection. And so you just cannot use the CRP as a marker of inflammation in these patients. And now as a rheumatologist, this is something I get called about a lot, because if a patient ends up in the emergency room and they look super sick, they look like they have a really horrible infection, but their CRP is normal, oftentimes we will get called because then the doctor is wondering if maybe this is actually their rheumatologic condition that's flaring or an unusual aspect of it, when in reality they are actually just sick and infected, but their CRP is normal because they're on this certain medication. So in these instances, or for these patients, you will have to use a different marker of inflammation, whether that be platelets, ferritin, fibrinogen, ESRs. You just can't rely on the CRP. Because in practice, a normal CRP is actually something that we use to see if the drug is working. So it's really not a marker of how much inflammation is in the patient's body. And now if someone does have a high CRP and they're on one of these medications, it can either indicate that the medication is not working, or maybe the patient isn't taking the medication. But again, in the vast majority of patients on an IL-6 blocking biologic, their CRP is going to be normal no matter how sick they are. Now this is really important, so if you know anyone in healthcare, please make sure you share this with them. Or if you happen to know anyone who is on this type of medication, make sure that they know as well. And if you like this type of information, make sure you like and follow along. And if you have any questions, please leave them in the comment section.